Cardiopulmonary resuscitation or CPCR is mainly given when we find a patient unconscious and the patient has stopped breathing, as well as there is no palpable pulse, and pulse where we check is at the carotid pulsation. Okay, and you shouldn't waste more than 2 seconds for checking pulsation, and if there is no response, first you try to wake the patient up, alert the emergency response, call for help, and then start good quality chest compression. So I am talking about the latest guidelines of cardiopulmonary resuscitation, that is according to the American Heart Association 2020 guidelines, which comprises of where you have to give the chest compression. So first is you have to go for a good quality chest compression at the site of lower end of sternum. You have to lock your both hands, that is at the lower end of the sternum. Okay, and the pressure should be from the shoulder, and elbow has to be locked. Hip will be acting as a fulcrum. Okay, so the site is at the lower end of the sternum, and the good quality chest compression should be given at a rate of 100 to 120 per minute, and at a depth of 5 centimeter or 2 inches, and with minimal interruption of compression. There should not be stopping of compression in between securing airway or giving rescue breaths. So there should be minimal interruption, and if it is a single rescuer, you have to give chest compression at a rate of 30:2. If you are a dual rescuer, it is at the rate of 15:2. This is I am talking about the adult CPCR. Okay, now when and the cycle has to be continued for about 2 minute cycle, and you have to check for any return of spontaneous circulation by checking the carotid pulse. If it is not available, you have to continue again with the CPR till there is a return of spontaneous circulation, as well as an emergency help arrives in the from ambulance. Okay, and once we reach the hospital, first and foremost will be securing the importance will be for securing the airway. So circulation we are compressing with the continuing with the chest compression. So it's first emphasis is on circulation, airway and breathing. And meanwhile, if there is no return of spontaneous circulation, you can continue with the CPR and then instill 1 milligram of epinephrine. 1 milligram of epinephrine can be repeated till there is return of spontaneous circulation. And you have to secure the airway, continue the CPR till there is